Good evening, everyone. I'm George Chow, MLA for Vancouver Fraserville. We're live on behalf of all my legislative colleagues representing Vancouver Coastal Health Authority Region, from Whistler, the Sunshine Coast, the North Shore, Vancouver, Richmond, and every community in between. Joining me is my co-host, Teresa, the MLA for Richmond North Centre. Along with us tonight are Mary Ackenhusen, President and CEO of the Vancouver Coastal Health, and Dr. Patricia Daly, Medical Health Officer of Vancouver Coastal Health. And I'd like to acknowledge that I'm here tonight on the traditional territory of the Coast Salish folk, and recognizing that some of you may be joining from other territories throughout the province. And I want to take a moment to thank all of our healthcare workers and all of those on the front line for everything you have doing for the people of BC over the past weeks and months. It has been truly inspirational, and I know some of you came off the thank you ceremony we have every night for all of them at 7 o'clock. About 15 minutes ago, we had that, so I'm very happy. I also want to thank everyone watching tonight. You have done so much to keep everyone in BC safe. We know it's been extremely difficult, but we have flattened the curve, and now we must continue to hold the line. So throughout your question, we want to talk about how things are going, what's next, how things are progressing in our fight against COVID-19. I'm going to hand this over to my MLA Teresa to give us a quick overview of the next hour. Teresa?
Thank you, Chow, and thank you all for joining us tonight. I would like to say a quick thank you to Minister Adrian Dix, my colleague Lom Letlick, all MLAs and support staff who have worked so closely with Vancouver Coastal Health and other regional health authorities over this past few weeks to conduct town halls like this one. And of course, big thank you to all our medical staff and frontline workers here in Vancouver and across BC who continue to support and protect British Columbians against COVID-19. Lastly, thanks to all British Columbians and the efforts of each and everyone here for staying informed and abiding by the orders of Dr. Bonnie Henry and our provincial health authorities. Restrictions slowly starting to lift, and it is great to be able to start this town halls with a bit of good news. However, as we are all aware, restrictive measures will need to remain in place for quite some time moving forward. So I'm hoping that this town hall can help shed some light on what the reopening of elective surgeries, dentist offices, and other services will look like over the coming weeks and months. So thank you once again, and I look forward to hearing all your questions. Our in question tonight will be our special guest, Mary Ackenhusen, CEO, Vancouver Coastal Health, and Dr. Patricia Daly, Medical Health Officer, also of Vancouver Coastal Health. Mary and Dr. Daly, would you like to introduce yourself so that our viewers know what it is you do?
Sure. I'm Mary Ackenhusen, and I am the lead for Vancouver Coastal Health as the president and CEO. And just, I too would like to add my thank you that you both have already expressed to the amazing team that's behind myself and Dr. Patty Daly, making what could be a very terrible situation as good as it can be. We're very proud of our team, both at Vancouver Coastal Health as well as across all the health authorities, in terms of what the public health efforts and the collective effort all our folks have been able to accomplish in terms of keeping British Columbians safe. So thank you very much, Teresa.
And my name is Dr. Patty Daly, and I'm the Chief Medical Health Officer at Vancouver Coastal Health. And my team of public health staff, medical health officers, public health nurses, environmental health officers have been on the front lines of the COVID outbreak, following up on all the cases and the contacts to date. They've been working with our community as we've been so successful in flattening the curve, and we do owe a debt of gratitude to the public for that, because you've followed the health advice, not just the public health orders, but the advice to stay home if you're sick, wash your hands frequently, and respect social distancing. And now my staff are helping on the recovery efforts, working with those businesses that are reopening, answering questions. We're all very committed to making sure that as we restart and recover, that when they open their businesses, they maintain appropriate safety precautions so we don't see a rise in COVID-19 cases. I'm happy to be here tonight with MLA and MLA Chow to answer your questions.
Thank you, Mary and Dr. Daly. In advance of this town hall, I asked British Columbians to submit their questions on COVID-19. MLA Chow and I will take turns reading out your questions, and either Mary or Dr. Daly will address them. If you are watching from the Government of BC Facebook page, you can submit your question in the comment section down below, and we will have a chance to answer later this evening. Please go ahead and submit your questions now. So let's get started. MLA Chow, would you like to bring up the first question?
Well, thank you. Let's start off our town hall this evening on a topic that we continue to get asked about. As business are slowly reopening, many are requesting that staff and customer wear a non-medical mask when they are on premises. So folks would like to know, how do masks protect you? And what's the best way to wear a mask? Our doctors, would you like to give
Sure.
the answer?
I'm happy with that question. We have not actually recommended the use of non-medical masks for the public here in Vancouver Coastal Health. And that's for a number of reasons. First of all, masks will not protect you from getting infected. If they're worn by somebody, it's to prevent them from exposing others to their droplets. So there's a lot of deceptions about masks. We don't want people to believe that it's what they need to do to protect themselves from infection. Recently, Teresa, Canada's public health officer, has said that we may consider non-medical masks if you're out in public and you can't maintain social distancing. But it should not replace the other very important recommendations, which are stay home if you're sick, wash your hands frequently. When you're out, avoid touching your face so you don't inadvertently contaminate your eyes, nose, or mouth. But if you do go into a public setting or a business and they've asked you to wear a mask, for example, because it's not possible to maintain 2 meters distance, then please comply and they will provide you with a mask. So, for example, go into a hair salon and they ask you to wear a mask, then please do so. If there is a business that asks you to do so, they will provide it for you. But masks are not required out in public. They're not required in transit or other public places. But please respect the request if you go into a business and they ask you to wear it and they provide you with that mask. Just remember, it does the place of all the other measures that we've recommended to prevent you from becoming sick.
Thank you, Dr. Daly. Here's another question about masks as well. If the cleaners are left alone in your home to clean the house, should the cleaners wear masks in case they cough or sneeze to protect homeowners when they return home?
No, I would. There's no need for a cleaner to wear masks in that setting. When we talk about recommending, it's for situations where people are face-to-face, close to one another, and can't maintain that 2 meter social distance. That's not the case with a cleaner in your home who is using cleaning agents, which, by the way, are going to kill any bacteria or viruses that may be on surfaces. So there's no need for a cleaner to wear a non-medical mask.
So, another question. In addition to a mask, folks also had questions about other forms of protection. Specifically, a question from Dan in Vancouver, who asked, what would be the medical opinion on citizens wearing gloves out in the stores? Then he said, I feel they're just spreading virus from store to store instead of using proper hand hygiene, similar to people wearing masks and feel they need to physical distance anymore. So would you please provide some light on that?
Sure, I'm happy to take that. And I completely agree. People wearing masks, it should not replace physical distancing. I actually do not recommend that people wear gloves when they go out in public because they may not then appropriately wash their hands. If you're going shopping, if there's alcohol-based hand sanitizer in the store, use that. When you leave the store, and when you get home, wash your hands unpack your groceries and wash your hands again. I do not recommend that people wear gloves when they go to the grocery store.
Thank you, Dr. Daly. So Trish from Richmond has a two-part question about doctor offices opening up. She asked, when doctors' offices open up again for face-to-face visits, virtual appointments don't work for everyone or every diagnosis. And another question, are both Vancouver Coastal Health and Teresa Health going to the same guidelines? Some of us have doctors and specialists in both regions.
Right. Well, maybe take that one, and Patty, if you have anything you want to add. So certainly doctors' offices are starting to open now. Everything that we see opening, whether it's in the health authority or a private GP office or a private specialist office, it's happening very gradually because we're taking very slow, measured actions to make sure that we do it right and do it safely. So certainly there are guidelines that all the GPs and specialists are following that come not only Bonnie Henry, who we all, she has her guidelines, but also the College of Physicians and Surgeons have given guidelines as well as WorkSafe BC. So the physicians' offices are abiding by those guidelines and gradual opening. There's certainly an acknowledgement that while virtual health was important in the past, because of access for people who otherwise might not have access, there is certainly a need for face-to-faces. And now this opening should allow for physicians to triage by who can benefit from a visit still and who definitely needs a face-to-face visit. So because we're all in the same guidelines, what we do in Fraser Health should be very similar to what happened in Vancouver Coastal Health. But we have to acknowledge that none of these offices have been set up for this type of social distancing. And so the logistics in each office could be different. So it won't necessarily look the same. I'll just, I had a funny event because I went to see a podiatrist a couple of weeks ago, and it was a very visit. But yes, I did wait on the sidewalk until I was called in by the single receptionist to come and have my appointment. So it won't look the same, but it will most certainly be a very safe visit. Patty, anything further on that one?
No, I agree.
Yeah.
Thank you. So Michelle in North Vancouver would like to know, what do we know about the effect of COVID-19 among children in light of the new illness that's affecting kids in Italy and also New York?
Well, first of all, we've seen very few cases of COVID-19 among young children. And we've tested thousands of children. The rate of positive tests is much lower in children than it's been in adults. And it also appears that not only are children less likely to be infected, they seem to be less likely to transmit the virus once they are infected. This has not just been seen here in BC, but that's been described all around the world. This unusual syndrome that's been described in the United States and some other places, it's called Kawasaki disease or Kawasaki-like syndrome. And that's Kawasaki's disease is known to occur in children after infections. It's an inflammation of blood vessels. We don't know if it's related to COVID-19 or whether there's a higher risk of this occurring in children infected with COVID-19 compared to children who may get other infections. It seems to be rare so far, and we have not seen any cases here. The good news, as I said, is very small numbers of cases in children here in BC. They appear less likely to be infected and less likely to transmit the virus.
Good to Dr. Daly. I have two grandsons, so I'm really concerned about this particular question. So with the nice weather ahead of us and what would have been summer holidays for many, Daly in Vancouver would like to know are the best practices when traveling to another part of BC?
Well, my next piece of advice is if you are sick with symptoms that may be suggestive of COVID-19, even mild symptoms, you should be traveling or exposing others to your illness. You can go and get tested because we're encouraging everyone to be tested. If you're feeling well, certainly there will be people traveling this summer in BC as we start to open the economy. I think that's a good thing, but you just have to be respectful when you travel. As again, respect that social distancing. Be sure to wash your hands frequently. And if you're sick, stay home. Don't expose others.
That's very good advice. And people have been following Dr. Henry's order about physical distancing. But of course, there are instances there may be people who have not been. So Danny in Richmond wants to know, haven't the residents been in compliance 100%, 99%, 95% with the social distancing so far? Will you please enlighten us on that?
Well, first of all, I think our population has actually done a fantastic job on social distancing. That's how come we were able to so successfully flatten the curve here in British Columbia, more so than many other jurisdictions have. In fact, the level of transmission now in BC is extremely low because people have done such a good job. They've been compliant. We knew when this recommendation was put into place, and it wasn't an order, the physical distancing was a recommendation, that there's some instances where it cannot be followed. For example, those of us working in healthcare, we have to provide direct care to patients. We have to get closer than 2 meters. Someone who works in a daycare will have to get closer than 2 meters to take good care of children. But we knew that we didn't need 100% compliance in order to flatten the curve, and we've done so successfully. Now, as the WorkSafe BC guidelines have come into effect, that as businesses reopen, there will be a number of options for ensuring that the public is safe. If you can't maintain physical distancing, you may see plexiglass barriers put up, as we have in a grocery store. Or you may see instances where you're asked to put on a mask, such as at a hairdresser, or where staff wear a non-medical mask. So there are a variety of options. You don't have to maintain physical distancing in all instances if there are other ways that we can reopen safely.
Thank you, Dr. Daly. We have a question on testing and the efforts being made in that area. Peter in Vancouver's West End asks, with the lack of testing and they being the largest pool or source of the coronavirus, with many being asymptomatic and woefully tested in BC, why are we not warning seniors, those at greatest risk, to stay in isolation? Stop encouraging my 81-year-old mother to go and get her hair done.
First of all, we can't assume that there's a lot of asymptomatic COVID-19 among young people. In fact, we have thousands of people under the age of 19, and we found very low rates of positivity. So we actually think there wasn't as much COVID-19 among children and youth as there have been in some other populations in BC. So that the rates are low. We also have no evidence that people, even if they have an asymptomatic infection, are spreading the risk. If they were, we probably would not have flattened the curve. Now, when it comes to older citizens, that is the group at greatest risk of severe COVID-19. So that is a group that needs to take precautions. But we do want to create a safe environment so people can go grocery shopping. They can go back to the hairdresser. And I believe that the guidelines that have been developed by WorkSafe BC, along with public health, will provide for safe environments in those settings, and people can feel confident if they follow the advice that they will be safe.
Oh, that's nice to know. And we know the government had previously made a difficult decision to cancel and postpone scheduled surgeries at the start of the pandemic. But now we are starting to give people the surgery they need. As from North Vancouver asked, my knee replacement was scheduled for March 27th. It was canceled. I'm now number 20 on the list, but my surgeon cannot perform more than one surgery a week. The end result is I'll be hovering around in pain for 5 months. Why?
I'll risk that one. So it's certainly right that we did cancel the surgeries a few months ago. The reason that we were preparing at that time for a peak that we didn't know how large it would be. And therefore, it was very important to make sure that we had actually a lot of extra capacity within the hospitals to accommodate COVID patients. And the easiest or most straightforward way to do that, really the only way to do it in the volumes required, was to cancel surgeries. And so we canceled all elective and some primarily elective surgeries. At the same time, we did continue all emergency surgeries and urgent surgeries. So as we ramp back up, we're being very careful, knowing that we can't bring everybody in at the same time. we're being very prudent to figure out who needs the surgery the most. And certainly those who are on this with urgent surgeries, for instance, cancers that we've not been meeting wait times for, so the individuals that we need to address first. That's not to say that knees and hips are not important. They are. We will get to them, but they're not going to be the first ones that we bring in. Because right now, the procedures that we use in our surgical ORs now are slower than they used to be for a number of reasons, in order to make sure that we're managing the surgery in a very safe way. So we're testing individuals before they, on the day of surgery, to make sure that they are not positive, so that if they are positive, our staff can be properly decked out in their PPE to make sure that they're safe. And the enhanced cleaning protocols, there are a number of things that make it less efficient to do surgeries right now. Our challenge is to ramp up in a very safe way, which means that we've got to be very prudent about who start with and make sure that the most urgent cases get performed first. That said, there is a very ambitious program that has been laid out by Minister Dix to do everything we possibly can to catch up with the missed surgeries over the next 12 to 24 months. And we are continuing to work aggressively to do that. So we will, as we learn how to safely do these surgeries and as we get more efficient with our new procedures, we'll start to see surgeries more and more happening. And so I don't know this individual knee surgeon who once a week what his new schedule will look like, but it certainly is all of our priority to ramp up as quickly as we can so that everyone gets the surgery that they've been waiting for. And we're starting that with calling all the individuals on the list first and foremost to make sure that they still want their surgery and that we understand exactly what they need to feel safe before they come in.
Good to know. Thank you, Mary. Mm-hmm. So Patrick Forshman also asked a very similar question. I guess it is for you, Mary, also. He said, I have a spine surgery scheduled at Lionsgate Hospital. The surgery was cancelled due to COVID. I was told my surgery is regarded as a priority. How long will I have to wait?
I can't say I know the exact answer for Patrick, but as always, it would be best for him to call his surgeon. His surgeon will have the best idea in terms of what that wait might like. But we are certainly trying to get folks who are in pain and who are suffering quality of life, trying to put those as close to the top as we can.
Well, thank you. Thank you both for, pulling all stops in order to help our patients. And there's a question from Carrie in Vancouver who's asking, what will screening mammogram and ultrasound be available? These are life-saving and time-sensitive procedures that seem to be available in some hospitals or cities, but cancel indefinitely at BC Cancer Agency because they are not deemed essential. So would you please provide some light on this question?
Well, I did ask about this because I knew this question was coming tonight. I contacted the Provincial Health Services Authority, that's BC Cancer Agency, as part of that. Screening mammograms are important. They are a great way of helping to prevent from cancer. They were considered non-urgent or emergent. They were put on hold during the last several weeks. But BC Cancer Agency is actively working to start screening mammograms and will hope to have them up again in June. But they want to emphasize that screening mammograms are for women who have no symptoms. If you have any concerns about your breast health, you should contact your care provider, and you can get access to care more quickly if there's a need for it.
Thank you for that response of the Daly. As a woman, I'm so pleased to hear that. So now question about Peace Arch. Harley in Richmond asks, will Peace Arch Park open and no requirements to quarantine? How will this affect our curve? Scary, this loophole lots are using.
Well, I know there's been some articles in the paper about as provincial parks have opened. And actually, we've been encouraging people to be outside because we think it's healthy. And also the risk of transmission of COVID-19 is much reduced outdoors compared to indoor environments. I know there's been stories about Peace Arch Park because there is an opportunity for people to, for example, see a spouse who they haven't seen is on the other side of the border. But the numbers are small, and I don't think the interaction of people who know each other, who may be at Peace Arch Park, is going to affect our curve. I should point out that while the border remains closed to non-essential travel, there are travelers, essential travelers, going back and forth across the border between Canada and the United States. For example, if you think about our food, our goods and services that have to cross the border, truck drivers and others. So that traffic has continued, and there are people who screen to make sure people don't have symptoms when they're coming back and forth. So I don't think that one provincial park and a small number of people from each side of the border who may interact there, who are going to be people who know each other, is going to impact our curve. I would also say that as we look across the border at the COVID-19 outbreaks in the United States, Washington State has actually done quite a good job in also flattening their curve compared to some other places where they've had more severe outbreaks. So I think even though the border will remain closed for the next few weeks at least, I think there's been good news on both sides of the border, and the current traffic across the border, I think, is well managed, and we haven't seen that it's led to any increase in cases in British Columbia.
Well, thank you. So, Nigel and Andrew in Vancouver asked, we're currently in phase 2 of the BC START plan, which sees businesses reopening and easing of restrictions. But does phase 2 changes anything for people who are immunocompromised or at risk? Easing of restriction ease anything from individual like us, or are we going to be on phase 1 until a vaccine is created?
Yeah, that's a good question. I don't think it's reasonable that people can't resume some of the things to do in their lives because they're worried. They may have an underlying health condition that they're worried about puts them at risk. First of all, let me just emphasize that when we look at the people who've been most severely affected by COVID-19 in BC, it's been residents of long-term care facilities. And that's why we've had quite restrictions on, for example, visitors to long-term care, because we want to protect that very vulnerable population. Whereas we do talk about older adults or adults with other underlying health conditions who could be at risk of more disease, but the rates have been much lower outside of those in long-term care of severe disease. Having said that, I understand that individuals may be concerned. What I would like to provide you with some reassurance that guidelines we're putting in place, phase 1, phase 2, and phase 3, are designed to keep you safe if, as you go out, for example, go to the grocery store, go to the drugstore, access healthcare services. Again, whether or not you have underlying health conditions, you should be able to have your healthcare needs met, get your essential services of daily life, and still be safe. So I would provide you that reassurance that levels are low right now of COVID-19. The plans that are being put in place are designed to keep us safe as we reopen. And we will be closely monitoring the rate of cases of COVID-19 through each phase of the recovery. So that reassurance for the whole population, including those who are worried about their own personal risk.
Mm-hmm. Good to know. Thank you, Dr. Daly. So now we have a question around long-term care. Policy have been put in order to keep our most vulnerable citizens safe during this pandemic. And we know how difficult it has been for families whose loved ones are currently in care. With mine, Leanne from Powell River asks, I have a neighbor whose father is in a long-term facility. He recently had his leg amputated and is 91 years old. She has not been allowed to visit with him before or since the operation. This has extreme stress for both of them. Can an exception be made so that she and can support each other? All she wants to be is to be able to see him, hold his hand, and assure him she's there for him.
Yeah. That is such a tough question. I think Minister Dix and Bonnie Henry get that question every day at their daily briefing almost, and it's one of the ones that internally to VCH we also talk a lot about because it's such a fine balance between the danger that, as we know, if you follow the statistics, the large majority of deaths in BC have been the long-term care facilities, are very vulnerable, fragile seniors. And so the balance of making sure that don't have outbreaks that would obviously could be fatal to individuals there versus that good policy is something that we all struggle with every day. But for the moment, we're continuing to reserve the only visitation rights will be for those for what we call compassionate care, basically end-of-life care, palliative care, which I'm not sure if her father falls in that category or not. But one of the things that maybe people don't think about as much, they know that they can say hi through windows, they know they say hi virtually, but the long-term care facility is the home of that resident, and that is free to leave that home if they have the capability or the supports to go visit outside of the facility. That is perfectly acceptable and available for them. So maybe that offers an option to her that she considered. But we're all very concerned about that and doing everything we can to make sure our seniors are not any more isolated than necessary to keep them safe.
Thank you, Mary. I could really empathize with that. So finally, our last question before we move on to live question coming from the Facebook is a question from Kate in North Vancouver. So in these two schools, there is much written about the low infection and transmission rate in children in regards to high school, up to what age a student considered to be children.
Well, I would say, Patty. The infection rate has been low under age 19. So it's right up, kids all the way through school age. There's been very low rates of infection. I would say we are encouraging schools to reopen in June and to have students come back in. And that's because we don't want to wait till September when all the students will be back to work out some of the safety plans that schools will have to have in place in order to keep both students and safe. So we are encouraging schools, and we as public health officials will work with school districts to help them have students come back in June. Now, it may not be all students coming back all at once. It'll be only a certain percentage of students. There will be some virtual learning as well as in-person learning, but we think 1 month in June will provide schools with a good opportunity to work out the appropriate procedures that can keep both the students and staff safe, and then they'll be prepared in September to reopen more fully. Low rates right up to youth right up until the end of high school so far, and that's one of the reasons why we believe that with the guidance that has been in place in BC, we can safely start to reopen schools.
Thank you, Dr. Daly. Now we'll move on to the live question that you have been submitting in the section below. So the first question is from Sandra. Her question is, are antibody tests available for anyone who wants to get one, even if we pay for one?
So I can answer that. Antibody tests are not a test of infection. You have to get a swab to test to see if you're acutely infected. Antibody tests can determine if you've had a past infection in the past. So it's not for diagnosis, but it's to look for example, immunity to the virus. Now, there have been a number of antibody tests that have been developed, and recently we participated in some validation of certain tests. So that means we work with the BC Centre for Disease Control and the federal government to determine, do these tests work properly? Because we have seen in some other countries where they've introduced antibody tests and they haven't been accurate. So once we get the results of all that validation, we know which are accurate, we're then going to decide how we should be using these tests. Who should they be available for? Who would we like to be tested? And those decisions have not yet been made. I do anticipate that we will be making those decisions very soon, and we will make tests available for those for whom we think it's most appropriate. And I do believe that we will do some screening around the province with antibody tests that can give us a better idea of the percent of people who might have been infected with COVID-19. But right now, we're still in the process of making those decisions, so the tests aren't yet available here in BC to the general public.
Thank you. And Michael is asking the question I'm asking as well. So what metric need to achieve before the long-term care facility can be open for visitors? Because I have many of these kind of facilities in my riding. Thank you.
Well, yeah, I agree with everything that's said. This has been the population most impacted by COVID-19. 2/3 of our deaths in Vancouver Coastal have been in residents of long-term care facilities that have had outbreaks. Now, very fortunately, we have only a small number of outbreaks still underway. I think we want to wait to see that those have all resolved. And then we'll begin putting in place recommendations for how we could, in future, working with the Ministry and other health authorities, consider the visitor policy. Right now, it's considering, but I do think as those outbreaks are on the decline, we will start to have discussions. Right now, visits are permitted for essential care by family in our region. If a family member is providing essential care to one of the residents, they can ask for an exemption to the order against visitors, and that can be considered. But we will start to have those discussions. It's not at this moment. In the next few weeks, we will certainly work with colleagues and consider those questions.
Thank you, Daly. The next question is from Chi Kwan. Is it safe for me to cycle a group of other cyclists for several hours at a time when everyone is breathing hard and in such close contact? How many people would be safe? Should we be further than meters apart when we are all panting?
Well, the 2 meter recommendation, excuse me, the 2 meter recommendation applies even for those doing physical activity. No need for greater separation. And I think I said before, being outdoors is actually lower for transmission of COVID-19. So I think you can certainly cycle with people. We do still have order against more than 50 people gathering at once, so I wouldn't cycle with any group larger than that. But if you're making 2 meters distance between cyclists, I think that's perfectly fine.
Yes, and another question from Stephanie. Is it okay to let our teenagers hang out with a small group of friends now? Can they go inside their friend's home, ride in cars with each other? This is a huge issue with our team. Yes, please.
Well, that's one of the reasons why I want the schools to reopen, because one of the things we know in public health is that when we close schools, that teenagers will find other ways of getting together, and it's in a less controlled environment. So we better have them back at school where they can see their friends, and it can be in a controlled way. Having said that, we also know that since we flattened the curve, that we have said to the public that our now modeling indicates you can increase your social interactions carefully to a few extra people and it not result in a significant increase in cases. So that may mean that you as a family, you might have another family that you interact with more closely. It might be a small group of people with whom you work with. Among teenagers, it'd be a small group of friends who they know well. It wouldn't be interacting with different people every day, but it's people who they know are not sick, who haven't recently been in contact with COVID-19, and I think that's perfectly reasonable. But one of the reasons we like schools to get back up and running is that will give young people an opportunity to see and interact in a controlled way with others.
Thank you, Dr. Daly. The next question I think many people want to ask is from Sylvia. Is it safe to get a haircut? Should both parties wear a mask?
I will say that WorkSafe BC has guidelines for hairdressers and hair salons, and they have been able to reopen after the long weekend. So some are already open. Now, the guidance will include things like knowing to get a haircut if you're feeling sick, if you've recently come back from traveling abroad, or you've been in contact with anyone with COVID-19, you should not be going to the hairdresser. And the staff should not be coming to work if they feel sick. When you go to the hair salon, you may find that the procedures are somewhat different, that they will have fewer customers. They will try and keep people 2 meters apart. They may have a plexiglass barrier between you and the cashier. But you may also be asked to wear a mask because it's pretty hard to give a haircut from more than 2 meters away. So it's likely that the hairdresser will be wearing a non-medical mask and will ask you as a customer to wear a non-medical mask so that you're not exposing the hairdresser your droplets, and they should provide you with that mask.
Thank you. And Diana wants to know, So for dental offices, will PPE, personal protection equipment, just be masks, gloves, and glasses?
Well, the good news about dental offices is that dentists always did a very good job in infection prevention and control. And most dentists were already wearing eye protection masks and gloves when providing care. These are the basic personal protective equipment that we do recommend in healthcare settings, including in dental offices when providing care. So you will see your dentist, and they are starting to open up now. I know my dentist sent an email. They're starting to rebook people whose appointments were canceled. And you can expect that your dentist will be wearing a mask, and will be wearing eye protection, and will be wearing gloves.
Thank you, Dr. Daly. The next one is very simple. It's from Jen. Do you recommend I sanitize all my groceries?
No, I do not recommend you sanitize your groceries. There's no evidence that has been a source of transmission of COVID-19. I think that that's pretty clear now. I recommend when you go grocery shopping, when you come home, you wash your hands, unpack your groceries, put them away, and then wash your hands again. You should be putting, for example, bleach onto your fruits and vegetables. Fruits and vegetables should always be, I always recommend running them on clean water as all that you need to do. And for your other groceries, there's no special sanitization required.
Thank you. That's nice to know. And Dan wants to know, is there a possibility in the future where ongoing cases are in more detail than by region, perhaps in a form of a map of some kind?
That's a question that we get a lot, that we've only provided cases by health region, and the health regions are pretty big. So ours is pretty big. What I will say is that one of the reasons why we haven't provided cases by local area, with small numbers, we don't want people to think that there's no risk of COVID-19. We want everybody to be practicing the public health advice, hand washing, social distancing. But I would say, and I think this wouldn't be a surprise to people, that there has not been an even distribution of cases, even in our region, that urban centers, whether it's in Canada, United States, or elsewhere, have had more cases of COVID-19. And that's because much of the virus has come in through returning travelers, and those are more concentrated in urban centers. The population is denser in urban centers. But we have had cases that have occurred in rural communities. Not every rural community has necessarily had a case identified. I want everybody, whether they live in an urban or rural setting, to take the precautions needed because they may not have identified everybody with COVID-19 by our testing to date. So there have been cases throughout our region, but there's been a higher concentration of cases in our urban settings compared to our rural settings.
Good. Thank you, Dr. Lee. The next question might be of interest to those who live in strata. So Carla asks, is the health authority going to issue guidelines with respect to strata outdoor pools?
We are in the process of working with WorkSafe BC for guidelines for pools. Stay tuned; those are coming. The good news is chlorine in pools will kill any virus. So the guidelines are mainly to ensure that people, for example, aren't congregating too closely together in change rooms or other places. So pool guidelines are coming. Yes.
Excellent.
So thank you. And Janice wants to know, if someone I know is traveling within the province, should I wait 2 weeks before I see them? What would be the advice?
We're not recommending that people need to quarantine for 2 weeks after travel in the province or even between provinces, actually. The only recommendation for that 10-day quarantine is for travelers returning from outside Canada. Now, certainly within BC, we have low levels of activity throughout the province, so I would say no. But anybody who travels there, or even if they don't travel, if you have symptoms, even mild symptoms of COVID-19, you shouldn't be around others. You should go and get tested. But we're not asking travelers in the province to quarantine for that 2-week period.
Thank you, Dr. Daly. So this question is from Shamin. My cardiologist has ordered CT and pulse. Is it safe?
I'll take that one. Certainly, we've done a lot of work with our medical imaging across all our hospitals, St. Paul's, VGH, Lion, etc., to make sure that the answer is an affirmative, yes, it is safe. So when you come in hospital, you will, all the hospitals have limited the entrances, so you can't come in any entrance as freely as you might have before COVID. So you will come into entrance and you will be greeted, you will be asked to wash your hands, and then you will be asked a few questions to just assess that you're feeling healthy and you don't exhibit any of the symptoms that we would be concerned about. And if someone is new, if they will be allowed to go with you if you need them for translation or mobility assistance. Otherwise, we would prefer that you not bring someone with you because we are really trying to keep as much social distancing in our hospitals as possible. And so when you move down to the medical imaging area at St. Paul's or any hospital, as you know, if you've been there before, they're not really designed for big open spaces. So each one will be managed in probably a slightly different way, but in a way that will enable you to keep your social distancing. I should mention, if you do have any cough symptoms, you will be given a mask. You will not be refused, but you'll be given a mask before you go down there. And then all throughout the hospital, you will see enhanced cleaning in the medical imaging area as well as other parts of the hospital. You will see reminders of distancing, whether it's the decals on the floor or signs elsewhere. But you will, every step of the way, you'll be guided either by signage or by a greeter or by the individuals in the actual equipment to make sure that you are being kept safe and that social distancing and any PPE that's required will be given to you to be utilized. So please come in for your CT scan.
Sarah also has a question. She asked whether the community center in Vancouver will opening soon because some of the activities like Tai Chi, amateur music ensembles, both of these activities can be kept 2 meters apart. Would they be able to open the community center so that they could do these kind of activities? Thank you.
We are working with municipalities. We want them all to be able to reopen their community centers, their grounds, and other places. They will need to have, just as our health authority does for the healthcare services, have guidelines, safety measures in place. So they're working through that so they can make sure as they start to open up to the public and begin to offer services that it can be done in a safe way. So yes, we will be supporting community centers to reopen. Those are by municipalities, of course, but we're working with them. We've encouraged them to reopen, and we're happy to support them to develop the appropriate guidelines so that they can reopen safely.
Good to know. Thank you. So the next question from Anita. Will hair salons be allowed to use hair dryer and blower? I think they will quickly spread anything in the air and be dangerous.
There's no evidence that using a hairdryer poses any risk. I would remind people that it's droplets produced when from people who are infected that are the source of infection. They travel about a meter and fall to the ground. You will find in hair salons, among the measures that will be in place, is likely to be customers wearing a mask will keep their droplets in. There's no evidence that a hairdryer drying someone's hair will distribute the virus or that virus is on the hair. So there's no problem in using hair dryers in hair salons.
So we ran out of questions already. I certainly don't have any. And is it time for us to... Okay, there are questions from Laura. What's the plan for the flu strain this year? And when will the flu vaccine be available, considering failure of this virus coming in the fall? Yes, please answer the question for Laura.
Yep. Well, influenza, of course, is a completely different virus than COVID-19. And I think one of the reasons why she may be asking about this is because one of the things that we are concerned about that in the late fall and the winter months, when we start back up in flu season, and there's more circulation of respiratory viruses, not just influenza, more people are going to come down with respiratory illness, and we won't know COVID-19 or something else. So one of the things we will be encouraging this fall is for everybody recommended to get their influenza shot. The vaccine, we don't yet have the dates on when it will arrive, but we think it will likely be at the usual times. The strains are selected every year by the World Health Organization, and the manufacturers determine the strains based on those recommendations. If you're among the groups for whom we strongly recommend you get a flu, please get one this fall, because if you can prevent influenza and we have less people with fevers and coughs, then we'll have less people who have to test for COVID-19. So strong recommendation, get a flu shot when it arrives this fall, and stay tuned. We'll let you know as soon as the virus is available this fall across BC.
Thank you, Dr. Daly. Again, the next question is concerned people who live in strata. So the question is, while commercial gyms seems to be opening again, what is your advice for condo gyms?
I think condo gyms can safely reopen. They would need very simple guidance. Maintaining 2 meters distancing between patrons would be recommended. We know that within condo strata, they won't have staff who can clean equipment between use. Most condo gyms could, for example, provide wipes that people could use after they've completed their activity to wipe down any surfaces they touch, such as on the treadmill or elsewhere. And I would recommend that you have a signage reminding people who use the facilities to wash their hands before they come, and after they use facilities, when they go back home, and when you're using the equipment, don't remember not to touch your face. So I think those facilities can safely operate with very simple guidance about people staying 2 meters apart and hand washing.
Thank you. And here's a comment and question from the Facebook. And the question is, are they still testing people that have no symptoms? There are still 3 and 4 per day. And we have heard that with every death, there are about 180 unconfirmed case deaths. So are the lower numbers of new cases accurate? Do you provide light on that?
We don't recommend that people without symptoms get tested because the test is not reliable in people without symptoms. So if you've been exposed to COVID-19, for example, we know it can take 5, 6 days, even up to 14 days before you get symptoms. If you test people too soon, the test may be negative. So we don't recommend testing until the symptoms start. Even very mild symptoms would recommend testing. I wouldn't, although we're getting small numbers of deaths, we can't assume that tells us how many cases there might really be in the population. I will say we're getting very low numbers of people now, new positive tests, even though we've encouraged everyone with even very mild symptoms to be tested. Very few cases admitted to hospital. If we were missing cases with testing, we would still likely see people coming into hospital with COVID-19. We're not seeing that. So we're pretty confident that the low level cases reflects the fact that there's not very much COVID-19 activity in our communities right now. In terms of testing people without symptoms, that will only be recommended on occasion by the medical health officer. For example, if you have a break in a long-term care facility, we might test all the residents because in that population, sometimes COVID-19 can have very mild symptoms. And of course, it's so important in that high-risk setting by everybody. But generally, we do not recommend people without symptoms get tested.
Thank you, Daly. This is the last question from Facebook. So the question is, I'm a teacher over 60. Is there an accommodation for older teachers over 60? I feel anxious for myself and my husband.
So I can certainly understand the anxiety as people have seen that risk is higher and for severe disease among older people. We've mentioned, Mary and I have mentioned in particular residents of long-term care. The median age of death in our has been 87 years of age, so that the risk is particularly high for people over age 80. But it is somewhat higher for other older adults too. I will say that the guidelines that we're putting in place, school settings, should keep both students and staff safe. And just to give an example, in our healthcare setting, we have healthcare staff who are over 60 years of age, may have other underlying conditions. And what we've said to them, if your doctor feels that you're well enough to work even without COVID-19, that we feel you're safe to work during COVID-19 with the appropriate guidelines and personal protective equipment put in place. So I would encourage any teacher, if you're concerned about your own personal health, speak to your physician, ask your physician whether or not you're safe to return to the school setting.
Thank you, Dr. Daly. So thank you so much, Mary and Dr. Daly, for answering this question. We are winding down now with just a few minutes remaining. Before I hand this off to my colleague MLA Chow to say a few words, I want to take this opportunity to raise one more question of my own for our guests. My question is, how do we ever plan infrastructure projects such as Lionsgate Hospital and Richmond Hospital while we are contributing to address this COVID-19 crisis?
Yeah. I'll speak to that. So we have a team that is in the planning stages for both of those facilities, Richmond General as well as Lionsgate Hospital. And certainly the learning through COVID have, if anything, underlined even more so the importance of replacing that very old infrastructure. Both of them are challenged in very similar ways around infection control and the way the configuration of the rooms and the washrooms are. I'm very happy to say that those projects are going forward just as quickly as they can. They have not been paused even through the COVID period. And so, well, like all construction projects, there are a few more hurdles than two in terms of getting these projects moving forward. They're both moving forward just the way you would like to see them. The only change being is that we're taking a quick review of each one to make sure that the learnings around infrastructure to better infection control, all those learnings have been incorporated in the design so that we're building for the future as well. So I would like to reassure, yes, absolutely, those projects are still moving forward and they still are considered important to the future infrastructure of Vancouver Coastal Health.
Thank you so much, Mary. That's very encouraging to the constituent in North Shore and in Richmond. So now back to you, MLA Chow.
Yeah, thank you. And I could assure you that the Health Minister, Minister Adrian Dix, is committed to those hospitals that MLA Watt was talking about. And thank you for your answer, Mary, enlightening us on what the status. We are not stopping despite the fact that we have COVID-19. And thank you once again, and colleagues like that are at the front line of this. And I certainly could really empathize with the people who have relatives and who are in seniors' home, because they are the most vulnerable. At the same time, they face the difficulty of actually seeing the loved ones and friends. So I'll be much interested, because my riding has a lot of seniors care facilities, and that I know you're all doing all you can to help them. And I'd like to thank you for that. And I'd like to thank all of you for joining us, all the listener participants, for your interest and all these good questions. So I would just want to leave you with a few additional resources with MLA. What would like to let us know on some of the things that you can do, some of the information that you may like to go and look at. Teresa, MLA Watt?
Yeah, thank you, MLA Chow. So for provincial support and COVID information, visit gov.bc.ca/COVID-19. This includes non-health related information such as financial, childcare and education support, travel and essential service information. This information is also available by phone. You can call 1-888-COVID-19 or 1-888-268-4319, 7 days a week between 7:30 a.m. 8 p.m. Pacific Time. For the latest medical updates, including case counts, prevention, risk, and testing, visit the BC Centre for Disease Control's website at www.bccdc.ca.
Well, if you or a family member need additional medical advice, please call 811. And for seniors looking for additional support at this time, please call 211 or visit bc211.ca. And you can also go to bc211.ca to sign up as a volunteer to support our seniors who are staying safe and staying at different facilities.
You can You can find information and links to this and more additional resources in the description of Townhall down below. If you have not already done so, please fill out the province-wide health survey, BC COVID-19 Speak, Your Story, Our Fear. Local data are essential for communities to support public health planning. Your equipped medical health officer across BC to support our health and well-being as we all need to live with COVID-19. The survey takes about 10 to 15 minutes to complete. You can do it online at bccdc.ca/COVID-19 survey, by phone at 1-833-707-1900, 7 days a week between 8:30 a.m. and 4:30 p.m.
So as we move into phase 2 of the BC Restart Plan, let's give this every chance of success in this phase by continuing to do what we have been doing at this time, staying 100% in. Let's continue to follow the public health guidance and protect ourselves and our loved ones and stop the spread of COVID-19 in British Columbia. For more information on our Restart Plan, please visit gov.bc.ca/RestartBC. And thank you again to everyone for joining us this evening. Keep well, be safe, and most importantly, be kind. And good night.
Good night.
Good night. Good night. Thank you.